live on Facebook. I am Samantha with the NVLD Project, and this is Linda. She's here with us today for our first Facebook Live ever. We are so excited to have her here. She's going to chat with us for the next 20 minutes or so, and then hopefully if you guys submit some questions on this video, we'll answer those for you to the best of our ability and get some advice and stories. And we're really just here a very casual chat with Linda today. She's one of our project social ambassadors. She's an adult with NVLD, and she also runs a tutoring center that she's going to tell us a little bit more about today. So I'm going to start by turning this over to her, and she's going to share her background and a little bit of her story with us today.
Hi, everybody. I just want to know if you can see and hear us, because we're kind of new to this Facebook Live. Can somebody say, yes, we see you, you're on, you're live? I'm going to tell you my story. I don't have a tutoring center. I work on, because tutoring kind of doesn't help, but I'll get to that. Okay. And if you have any questions, just type them in. But do you think that we're live? Do you think
it looks like we're live? We've got some people watching us.
Okay, we're watching us. Okay. So where do I start? When I was a child, I struggled tremendously. I didn't know what was wrong with me, but I knew something was wrong. I was terrified to go to school. I became school phobic. I had stomach aches all the time. And I remember telling my mom, guess what? My stomach doesn't hurt anymore. And she said, why? I said, because I don't care about school anymore. So I just felt like the teachers were talking a foreign language. And I didn't have any friends. I had a very hard time fitting in, and it got worse. I slipped through the cracks, because girls often slip through the cracks. I also have ADHD, which we can talk about how it's different from NVLD. And I was very well behaved, and it wasn't picked up. All it was the typical Linda needs to try harder, work harder. And I'm going to tell you, not much has changed in the schools today. We have a lot more awareness, but the same stuff is going on. And we'll talk about that too. So as I got older, I got very angry and I started to rebel. And I didn't slip through the cracks so much anymore. I was hanging around with people that were just like me, which was good because I fit in, but we tend to get in trouble, doing things without thinking, being impulsive. And I had a very rough road. I had great parents, but they didn't know because nobody knew about this. And I learned things the hard way. And I'm really lucky that I was able to, go to college. I put myself through college, cleaning houses, and do what I do today. I would have never thought I'd become a teacher because I hated school. They pushed me through. So fast forward, I was headed where I probably could have been pregnant and on drugs. Okay, but fast forward, I became a school teacher. And it does take your kids longer to achieve college. It can take 5 years. I didn't start till I was 22 because the brain is still developing up until the age of 25. And a lot of parents need to understand that, yes, you're going to have to support your kids. They're not at their level. So even though they're 27, you may have a 15-year-old on your hands. And you may be very frustrated and angry saying, I'm doing everything to help you. But you don't appreciate it because they don't get it. Nobody really is getting what's going on. So started teaching, realized that, you know what, I'm just like these kids. At first I thought they were bad. And in the 90s, nobody really knew much about NVLD at all, or ADHD. I was lucky that one of my parents was a professor and she educated me about it. And I said, hey, I have this. I had a horrible time organizing myself because we have a horrible time with that with NVLD and ADHD. My assistant helped me organize the classroom. I got an award from the governor. I did a great job, but I had to work so hard at it, it exhausted me because we have to work longer and harder to meet our potential. And I also wanted to make a difference, and I figured out I can't make a difference in the public school. I did a ton of research. I went out on my own. I was tenured. I wasn't asked to leave. And I was inundated. I started the first social skills program in New Jersey. And nobody was dealing with this. I was just inundated. And then I started helping kids the way I really wanted to help them. Yeah. And then I started researching about the brain before anybody was talking about the brain. And I learned a lot about executive functioning. It's a new popular buzzword, but it's been studied by neuroscientists for years. And I started doing brain training, and I was kind of ahead of my time. So it was hard to explain to people what it was.
Yeah.
And
Because no one knew.
because nobody knew. And so I was able to make a difference, and I've been doing that for over 20 some years. And it's not a job, it's my life. The things I wanted to talk about that we were saying earlier is that I pass so well, because look at me. I don't have two heads. Okay, I'm very well spoken. We are very well spoken with nonverbal learning. Words are our life, they're our shield, they're our protector. We can't function without them. We don't pick up, about 80% is nonverbal body language. We don't pick it up. We're very blunt, we're very literal. So if you have a kid, if you're a parent, and if you're an adult, please ask me your questions, because I don't want to say just kids. This is across the lifespan. It's not going to go away. But it's a lot more doable now. The first research said that there was a high suicide rate because people didn't know anything about it. But now that we're more aware, but you as a parent have to take action. The school does not have what you need to help your child. And I'm going to explain that. Everybody wants tips. Everybody wants strategies. I'm going to give you the biggest tip right now. Go online and research strategies. That's where you're going to find them. And I connected with Dr. Rachel Morgan, and something that I always knew, but she proved it in her research, that she didn't study the environment. She didn't study the child. She came up in her research that strategies and modifications do not make a difference. That's the easy part. The number one thing is the relationship between the student and the teacher, and trusting the learner and asking the learner how they learn. But when we think about teaching, I taught for almost 10 years. It's about compliance. I'm going to share this information. You're going to comply. And what we've known for years is you can have kids staring out the window, and they probably can be listening better than people that are just making eye contact. Now, when I went to school, I had a teacher that told me part of listening is looking, which is not true. Okay. And a lot of it has to do with the educator. And I'm not bashing teachers, because I was one, and they're overwhelmed. I can tell you that right now. And there's dead wood in any profession. Some go in because I know, I want my summers off, I want this. But there's a lot of good teachers. And they're just overwhelmed what they're expected to do. But where was I? The looking thing?
Yeah, how you don't have to look at someone to hear, and so talking about the strategies in the classroom.
Oh, right. So her research, right.
Yeah.
And she said that it's trusting the learner and listening to the learner. And I think the learner, to even expand it, they have to feel safe. We have so much anxiety going to school. I hated going to school. I was scared every single second. People that have nonverbal learning disorders and on the spectrum, and they're different things, but they do have some of the same characteristics, are scared all the time because they don't understand what's going on, and they're given a lot of negative feedback.
Yeah.
And the anxiety is really, really high. And if you don't treat this the right way, and I'm very opinionated about this, okay, I think I know the right way, you're going to struggle, because strategies of what they're doing in schools and IEPs and 504 plans are not the answer, okay? And that's what the research clearly says. Okay, so if my biggest tip is educate yourself as a parent, find out what it is, understand your child. I have a lot of parents that come in, and the young adults, they're ready to kick them out of the house.
Yeah.
And until they really understand this. And I go around and around with parents. And, some of them, I talk to them now years later. I'm like, I'm surprised you still talk to me. Because I would just go around and around and around. And I'll say, no, that's not it. He's not lazy. Yeah. I'm not giving them an excuse either, because there's part of kids just being kids. But, like I said, you can be 25 and have a 15-year-old on your hand. Don't be fooled by the bigger body. Yeah. And the opposition and the rebellion, because they don't know what's going on either. So this is another thing I wanted to tell you about Sally Smith. She's late, but she used to have this school called the Lab School in Washington, and she came up with these masks. when kids are uncomfortable, or even adults, because remember socially they're on a lower level, they start, it's embarrassing, okay? You look okay. People think you want special attention. I have friends that sometimes think that I can't tell them because, you know, it passed so well that, so you have a kid, they're sick all the time. They're going to the nurse. They don't want to go to school, like me, school phobic. You have one that's a rebel, acting out. I don't care about school, class clown. You have a people pleaser, okay? You wear these masks basically to protect yourself. And they don't know they're doing it. They're kids, you know, young adults. They're just doing it because they're trying to survive. And they lie a lot. And parents get mad at their kids because they lie. Well, what do you want them to do? If you can't have the expectation where they can meet it, and you're expecting that, and you're constantly expecting that, and they can't, they're going to lie. Would you like to go to work where you didn't fit in, where you were looked at as different? You would feel very uncomfortable. Right? And most of us don't work for anybody else. And we're really smart, okay, but very underestimated. Yeah. Because of the way you present. A lot of entrepreneurs, but I don't want everybody to think, oh, everybody's not going to be an Einstein. Everybody's not going to be a JetBlue guy, you know, and that's okay. But I lost that's my neurotransmitters blocking up. Keep me on track. Because sometimes I just go.
Well, and I think you were leading into some of the things that you and I talked about on the phone that parents can look for to know that their students might be struggling with a learning disability. Yes. I think you were kind of starting to get
I'll get into
that.
And young adults. And like me, I still do these things because it's brain-based, very clumsy, bumping into things. Okay. Eating is a lot of coordination. And crumbs, you know, my family, oh, we know where Linda was because all the crumbs are around her. You know, spilling things on your shirt. I have to be very, very careful, especially when I'm out in public. And like right now, I have to watch my tone of voice. I have to be aware of everything I'm doing, and it's exhausting. But to fit in, you have to do these things. So you're going to look for motor skill problems, fine and gross motor skill problems. Now, one of the neuropsychologists that I work with says this doesn't fit everybody. It's not a clear-cut thing. So you may read things, but it may not pertain to your child, okay? Because it's a discrepancy between your performance and verbal IQ, and there has to be so many points that's a difference. So one of the things I do is I'm terrible with keys, you know, putting them in the locks, any kind of like my printer, anything that's mechanical, I just get frustrated. I can't do it. And so look for that. And look for your kids being very, very literal, even adults. Like, I'll give you an example. Like a younger kid, one time when I saw a younger kid and I asked the dad, because my car wasn't working, I said, can you give me a jump? And of course, a kid in kindergarten is going to say, why does the car need to jump, Daddy? That's normal. But for people that are very, very literal, they're not going to get that. So they kind of fake and pretend they got the joke when they didn't. So you want to look for very literal. Another thing, which I know you'll identify with, is you probably said to your kids, oh my gosh, you're going to be an attorney. If you've said that, because they're very black and white. You didn't say this. You said that. And they will argue with you and argue and argue because it's either black or white. There's no gray. And then you have behavior problems because of that. Okay, being easily led, taking advantage of. These kids need to be protected in school. And it all happens on the playground, in the hallways, and they really don't have any protection. Because they don't know how to fend for themselves, because they don't have the ability to. Yeah. And they're naive and they're gullible. I had one kid eat an onion just to fit in, and they said, eat this. And he ate it like an apple.
One of our commenters is talking about how her daughter awkwardly laughs when she doesn't understand the social situations, which we talked about earlier as well. Yeah. So a lot of the things that I do are, I work with kids all across the country, no matter where they live. And I'm going to talk about executive functioning because that's the things you can look for too. Yeah. Okay, so I said the klutziness, being very verbal, getting lost.
Okay, if your kids need to go from one class to another class, they may not know how, and they may be embarrassed. They don't have that visual memory, that visual spatial, where is my body in space? What I did was, when I was in high school, I would follow the person that was next to me, so I would know how that I was in my next class, so I could find my way to the class. And when I was teaching, there was one school that I was in that had a lot of complicated hallways, and I had a really hard time with that. So I would go in right before or after school, and I just memorized it. I made myself learn it because I was embarrassed.
Yeah.
So you need to go in before the school year starts. You need to practice, get that schedule and practice. How am I going to get from here? How am I going to get to there? Organize the locker. A lot of the kids will get demerits because teachers think they're goofing off and they're late, but they're slower to gather their things to get to that next class. So that's also one of the things.
That brings a question to my mind. So how important in your life, when you were a student and even now as an adult and a professional, is that schedule and that daily routine? How important is that to you and kind of like getting through the day and all of that?
Yeah, it's really, really hard. And I can't tell you that people with ADHD and nonverbal learning disorders, we need structure and we don't like change. So like if you tell your kid, we're going to Kmart and we're going to the grocery store, and you throw one or two other things in there, they might just have a meltdown.
Yeah.
Because structure, they memorize their environment, so changes are hard. But when you have the ADHD component, it's so hard. And I can't stand it when people say, well, use your strategies, put your keys in the same place. Yeah, okay. We have to be able to apply them to do them. And when you have 10 million strategies, you know, they're not all going to work, and life happens. Like you're putting fires out all day.
Yeah.
You don't know if you're going to get there on time. You're so proud that you made your lunch. I used to be so proud. I made my lunch in the morning. I got up on time because with ADHD, it's so hard to get up in the morning.
Yeah.
Make the lunch, and then of course I'd leave the house and I'd forget the lunch there. And then maybe I had my outfit picked out, and then already that's a strategy, right? Well, I'm clumsy. I messed my top up. Then I putting clothes together is hard with colors. I tell people a lot of black and solids. So you can have these strategies, but it doesn't mean they're foolproof.
Yeah.
It's all about, and that's the myth of executive functioning. But what were we saying about before that?
Just talking about the importance of like
the schedule
and everything.
Right. So you can see how my mind goes all over. The schedule is very, very important for kids, especially getting them out of the house in the morning can be a nightmare. So one of the things you can do is, you know, you can have like a picture schedule, and you can have them buy into it, go on Google Images, everything you're going to do, put them on business cards, print them out, laminate them, get a poster board, even for older people.
Yeah.
Put Velcro on each side, put your schedule of all the things you're going to do. It has to be hands-on. Doesn't usually work on the phone, although for some people it does.
Yeah.
I do this, I go to the bathroom, I pull it off, and then I go there and I put it there. Because sometimes kids, you know, they get lost in the bathroom for hours. So you have to have, and when you have the structure, you're going to have less behavior problems and less anxiety.
Yeah.
But as an adult, it's still hard to have that structure.
Yeah. For
me. I still struggle with it. When I'm not anxious and when things are going well, then it's easy for me to have structure.
Yeah.
But so that's the schedule, and the routine is important.
Yeah. So another thing that you and I had talked about was for adults kind of honing in on what you're good at and your skills to have that success in the future and post school or later in life. And so I want to kind of tap into the adult side of having NVLD as well, and kind of how did you find what you're good at? How did you hone in on those skills? What did you do to make sure that as an adult that you're a professional, you've got this business and you're very successful and that kind of stuff.
Right. For me, I made it because I was more afraid of being a nothing.
Yeah.
And I have a lot of drive and a lot of perseverance. And that is what saved me. If you don't have that, it's very, very hard. And I don't have the inattentive type of ADHD where I'm spacey or daydreaming. So where you have a hard time getting started because everybody's different.
Yeah.
But I have seen a lot of sad stories, and they don't have to be that way. But unfortunately, they still are until we get like what you're doing with the project and what I'm doing, the awareness. You can't ignore weaknesses. Everybody wants to focus on strengths. You do have to focus on strengths, but you can't ignore weaknesses. You have to develop those executive functioning weaknesses to be successful. I have somebody that just lost 3 and 4 jobs. And, you know, by focusing on strengths, it wasn't enough. Okay, so you can focus on your strengths and do what you're good at and structure your environment for you. But honestly, the biggest thing is, before we even get into is having a mentor and having somebody care about you and having somebody that's going to guide you and take an interest in you. And I had that. My mentor was someone, when I started teaching social skills, gave me a space to teach it. Oh. And I learned more from her. I would go to so many therapists. They couldn't help me. Oh, but you're a teacher. You're this, you're that. And I would feel terrible because they would act like I didn't have any problems, and I had a lot of problems. But this person was not a therapist and just really saw me for who I was. Actually, she was, but she wasn't my therapist. Yeah. She was more like a business person, a friend. And I learned more from her relationship with me and going back and forth. You have to have somebody. Yeah. If you don't, then I say you go to a church. Keep trying to find somebody that's willing to understand you and nurture you and develop you. Stay away from toxic people. I know you want friends really bad, but you're not a beggar for a handout, and that's one thing I learned. You don't just accept anybody as a friend because they'll take advantage of you. I always liked people that were blunt and literal because I knew where I stood. But unfortunately, those people sometimes are very negative and critical. But find that mentor, educate yourself, and you need to really figure out what you're good at and kind of make your life work for you. Yeah. Because sometimes working for somebody else, unless you have a really understanding boss, I have a couple people that do, but sometimes disclosing doesn't help, and other people can be bullies at work. Yeah. So what I say is, strategies will only get you so far. So executive functioning is a big part of this. Okay, so everybody is saying executive functioning, and what they're doing in the schools is on-time tests, sit to the front of the room, color code, learn study skills, even for adults. Let me tell you, you don't want to learn study skills. By the time you're that beat up, and they're not going to help you. Okay, you have to work so hard to use those study skills, and you're already feeling so defeated and beat up by the time you're in middle school or high school. That's the last thing these kids want to do. And what you have to do is they are not executive functionings. They're strategies to use to help executive functioning. But now let's get into that. If you don't have a good memory and that kid needs repetition over and over and over and over to learn, okay, that you have to remediate that. You have to improve that memory. Yeah. An active working memory, if you can't use multiple things and at the same time without forgetting them, you're not going to be successful even working at a Home Depot, which I had somebody that had that and couldn't hold a job. So you have to remediate these skills. Auditory processing, they don't have the time to do this stuff in school. There's no research-based stuff in school. Teachers are very limited, even if they want to help. The best thing your teacher can do is have sympathy, empathy, and relate to the student, like Dr. Morgan says and proves with the research. They want to help, so that's the best thing they can do, but you have to take matters into your own hands. And you have to get that executive functioning, and a lot of people are not understanding that because now the brain has neuroplasticity. Everybody's jumping on the bandwagon now. Oh, it's the brain this, the brain that. They don't really know. I've been doing brain training for 25 years when nobody knew about it and thought it was quackery, just like chiropractor. So there's good programs online. There's not good programs online. I do a lot of home-based monitor programs, and I do a lot of long-distance things. So that executive functioning has to come up, and there are ways to do that. Okay, auditory processing. If you have CAPD, comes under many different names. They're going to sit you to the front of the room. They're going to either have the room wired so you can get it in better, it's not a hearing problem, or put something on the kid's desk, which is stigmatizing and embarrassing. You can remediate that, okay? It's a series of exercises. They're very intense, they're frequent, and they're for a period of time. Just like driving, and kids can text, they don't even look at it. And typing, once you got it, you do it. You don't think about it. Learning needs to be automatic, okay? Where you're not thinking about it, and strategies do not do that. So parents need to be educated. They need training. A lot of them get therapy, but therapy for these people, like I went to therapy, they just want to talk about your feelings. Nobody could help me. Everything that I do to help people, I've done myself. They just want to talk about feelings. Now, feelings are coping, teaching you how to cope. You know, deep breathing, counting to 10, meditation, you know, all that stuff is good. I don't want to knock it, but it's not good enough. You change the processing of somebody, you change the performance and the skill level, you're going to feel better about yourself. Yeah. And so I coach parents how to do this. And social skills, another thing is, social skills groups are good, but no kid is really going to benefit going to a group once a week for an hour. They're good for exposure. They're good. The first thing is you have to know the social skills before you can practice them. So you have performance deficits and acquisition deficits. Now, especially people with Asperger's, once they learn them, they can kind of take off because they like facts. Yeah. And I like facts too, and because we have that in common, we can kind of run with them. Yeah. 1 + 1 = 2. Nobody tells us about eye contact. Nobody says when they're rolling your eyes, you know, you're boring people. We need to be taught, and we don't learn by observation. Most people learn by observation in their environment. We don't. We need to be taught. Okay, just like math. Just like there's formulas. And parents need to know how to do that. Doesn't have to take a lot of hours. They need to know how to teach these skills simply and be a coach. Okay, Johnny, remember, oh, I love the way you're looking at me. Let's talk about eye contact. You're looking at me. That's so great. I feel like you're really listening to me. Oh, put them on some kind of incentive program. Remember, incentive programs don't change neurology. They're not going to change the makeup of your brain, you know, but they help to practice these skills and to build up self-esteem. So now we're going to go to soccer practice. Okay, remember we practiced the eye contact. Okay, go up to so-and-so. You need a coach. A lot of times they go to the groups. They don't want to go back because the kids are lower than them, or they're too high than them, or it's a one-size-fits-all approach. Or with the ADHD kids, if they're impulsive, they're like, Mom, I don't want to go back there. All that happened was she was like managing, you know, telling them to behave and do this and that. It was like romper room. If you're my age, you know what romper room is. And so, yes, groups are good, but I have a protocol that I follow, and that is test executive functioning, train it, build it. Once it's done, it's going to last forever. I tell people, don't get offended. I don't want you coming back to me, okay? Your homework is not going to take hours. You want your kid and your young adult to be independent. Then we clean up the executive functioning. Then we look at social skills. We do parent training, train kids, okay? Then I just have a whole protocol of things, and I do assessments, and then I figure out this is going to help you, and we do a lot of like tailored to you. Is it active working memory? Is it auditory processing? And then now I'm working with somebody that we've done all that. And it's kind of tricky because the mom doesn't want to be on the kid's back because she enabled the kid his whole life. The kid's 27. And she's trying to back off. But he's learned helplessness now because nobody told her he had a problem in school because he was so sweet and kind. Yeah. And now they just found out at 27. That he has a nonverbal learning disorder. And that's what I said. And, you know, you don't need, neuropsychologists are good. Sometimes I think it helps the parents more than the kid so they can understand what's going on.
Yeah, and that seems to be kind of a reoccurring theme with what you're saying is making sure that the parents really understand their children and how they learn and how they comprehend information and that kind of thing.
And get the right treatment because if you know, then they go away there, and I see parents waste thousands of dollars on college because mom isn't there to scaffold the brain anymore. Yeah. And they can't do it, not because they're not bright enough. When I get them, I say, look, you're going to stay out for a year. We're going to work together for a year, and you're going to go back. I had one girl that was in community college for 4 years. She worked with me. And not to say that I'm so great. I'm just saying that these are different ways that things you have to do. She didn't have any executive functioning, and strategies weren't going to do it. Because it takes longer for people like us. It took me longer to graduate. Went back, went on her merry way, became a teacher, just went through, and because the executive functioning was remediated, and it wasn't by strategies. Yeah. And it was by being understood, like Dr. Rachel Morgan's research says, having somebody believe in you, believing in yourself, having somebody be a partner with you, not being sympathetic, non-judgmental. And if you have a spouse that doesn't understand, you better get them to understand. Or because a lot of marriages break up over this. And that's a lot of what I do too. And I'll have mostly dads, angry dads coming in because they're working all the time, right? And they think you just can't handle this. And, you know, once they get it, they're like, oh my gosh, you know. So that's like the theme that I'm saying. Yeah. So the parent and the social skills is a big deal. 80% of life success is not what you know, it's social skills. So you really have to learn how to elicit those skills. So you have to, anything, it's like a foreign language. Like if you find yourself saying, look, I know I said this, but this isn't what it means. You have to explain that. And you may be exhausted. Oh my gosh, I have to explain this. I have to explain that. It's exhausting. But you have to do it because they are not getting it. And, you know, so like if you're going to go, you have to verbally put words to things that people don't normally do because we only learn by words. Okay? We can teach how to recognize body language and all that. But like if you're looking in the mirror before you go out, like everybody has a mirror by their door and you're like, all right, do I look good? Do I have anything in my teeth? You know, and you can't just do that because they're not going to pick it. You're saying, when you go out of the house, Johnny, okay, we're looking at yourself. Is your hair okay? Is it because you want to look presentable?
Yeah.
Right? But you have to say that. You have to put, and so this is the things, it's not hard for parents to do. They just have to learn how to do it and be trained. And a lot of times therapy doesn't really help. Yeah. You know, like going and just talking about feelings because it's skills based.
Yeah.
Yeah.
Definitely.
And I don't know if there was anything.
No, I think so. We've hit 30 minutes. I know. It's so easy to start talking about.
I could talk about this forever because this is what I do and I love it.
Yeah.
And I'm just saying, the other thing I wanted to say is that it's so invisible. And that if somebody is in a wheelchair, you're going to understand and open the door for them. Somebody has breast cancer, we understand that, but we don't understand we need support from people. And everybody's so busy, they don't have time to give it to you.
Yeah.
You know, but you do need extra support. And so you have to try to find people that are patient and kind to get that because you can, and you do this and you can mature and you can grow. It's just going to be like a lot of late bloomers.
Yeah. Yeah.
And I guess I had some notes, but does anybody have questions?
Yeah, if you guys are out there, you have any questions or want to hear anything, anything specifically from Linda or even from us here at the project, we've got your comments pulled up, so let us know.
Let's see. Sarah, my daughter does that too. Kelly, what does your daughter do, Sarah?
I think she was talking about, let's see, thanks for sharing your story. My daughter was diagnosed at 3, and story is inspirational. I don't know when she sent that, but I think that it was talking about the social skills and when you laugh at things that you don't
and I do that as well. And I have a lot of, I never spoke out about this before, but I'm speaking out, and I will tell you embarrassing things that happen to me because if I don't say it, nobody's going to know it.
Yeah.
Nobody's going to know. I think I told you the thing about the fork, right?
Yeah. Yeah.
This is kind of one that you really have to watch out for your kids sexually as well, that they don't, because they're dying to be accepted. Yeah. Being promiscuous, easily led by boys or men. One time when I had a job, they sent me for a physical, just a work physical. And I did not know that I did not need a gynecological exam for that. And there wasn't anybody in the room. And it was a young man. Now I look back at these things when I'm aware and I say, okay, that wasn't right.
Yeah.
And I was taken advantage of. At work, there were people in the kitchen, told me to drive them home. It was in Camden, the dangerous city in the country, in the middle of the ghetto. Didn't know how to get home. Got lost, because I get lost all the time. The navigator changed my life. I couldn't even get anywhere. Yeah. Okay? I couldn't get I could get from my house to anywhere, but when I got there, if I wanted to go somewhere else, could not get there.
Yeah.
But just, and when they're driving, you have to be careful as well.
Yeah.
So I, will share things that are embarrassing, and I've never really done that before, but I want to do it now because and that's why I went in teaching. If I can help one person not suffer,
Yeah.
That's my goal. So that's what she said.
So does anyone else out there have any questions or want to ask Linda anything before we shut it down for the day? We'll see if anything comes in. While we wait on some questions, yeah, I was going to say, while we wait on questions, Linda has a giveaway that we're going to do for anyone that comments, shares, or likes this video. So just let us know if you've got any questions. Oh, we have a lot.
And no matter where you live, I will do an assessment for you. And you can go to my Facebook, which is ADDvantages Learning Center. It's 2 Ds. ADDvantages Learning Center. Just put that like in the search box. I don't have the address, and it'll pop up.
Okay, so we've got a couple questions that I'm just seeing.
Well, what's this one? This is making me feel so. Go up.
Which one?
Go up more. This is
Oh wait, this
is making me feel so much better.
What you're saying is describing my daughter. Oh, we're so glad. That's why we wanted to do
I'm gonna
this.
cry now, Kelly. Oh my gosh, this trying to get her to school is going on, but because she's a quiet kid who just blends in, you start to feel crazy. Yes, you do.
Yeah.
Any tips on how to help the school see through? Yes. Okay. If you can get these teachers, they're overwhelmed. There's something that's as old as the hills, and I'm as old as the hills, because when I say that to the kids, they're like, what does that mean? Because it's like they don't get it, right? Nobody says that anymore. There's this thing, his name's Rick Lavoie. Go on YouTube, it's for free. It's called Fat City, Fear, Anxiety, Tension. And it talks about, now this is old in the 70s, you know, we have simulations out there that are on YouTube. You can go look at those up for sensory processing, ADHD, and you can see what it feels like to have these things because it's overwhelming. You're bombarded by stuff. But this is just old-fashioned being in school with a teacher. Now, back in the day, teachers could get away with saying, Earth to Linda, or why are you looking at the ceiling? The answer isn't on there. And I wanted to, now that I know, I'm looking up because it accesses my occipital lobe in the brain and I can visualize what's in my notebook. But I didn't know that then. So back then they could be very sarcastic and get away with it. But he puts these teachers in a position where some of them are almost crying. And if you can get them to watch that, and I'm actually starting some kind of simulation like this, going to update it, where he's like, he makes it coming at you after the other, and everybody, and the teachers are like, it makes you feel like what it's like.
Yeah.
Get the teachers to watch that.
Yeah.
Because he'll be like, what did I just say to you? I just said that to you. Turn to this page, do this. That's what it feels like. It feels like people are talking fast. So that's what I would say for the teachers.
And we've also got some resources on our site, just explaining NVLD and some interventions. You can share that with the teachers as well.
Take advantage of them.
Yeah, so we've got a lot of questions coming in. I know we're running out of time.
So can we answer those questions?
We'll definitely answer all of them in messages back to you. We'll just reply on some of these.
I can private message you or do a group or...
Yeah, so we can definitely answer them on the video. We'll just go in and
we'll answer them on the video.
I do want to answer this one. My NVLD son, who's 11, is a rule follower, but he is very impulsive. Any tips for helping him control that?
That's tough because I just read an article about a kid that was so impulsive and did something and really wound up hurting himself but didn't mean it. There is some medication. I know parents don't want to do medication, but if it's that bad and you're getting a lot of negative feedback, which can go into depression and anxiety and cause kids to be even more medicated, sometimes you have to weigh, is this better than the opposite? You know, I myself take Adderall, which doesn't help NVLD, but it helps ADHD. I absolutely hate taking it, okay? And I'm very holistic. Gluten, get off the gluten. The gluten is gunking the brain up. Get off gluten. Anything you do, 10% here, 10% there, it will add up. Impulsivity is just, I would have to know, I'm really good at, I need to know exactly what it is. If you tell me exactly what it is, then I have a way to get around that. But just impulsive, I need to know like what's going on. When is it happening? Where is it happening? You know, blurting, you know, definitely frequent breaks are always a good thing. But again, brain training. I see somebody's asking about visual spatial processing. That person knows that, yes, training the brain helps impulsivity.
Yeah.
I use a lot of programs that I monitor, Brainware Safari, the listening program, but you just don't want to do these programs. You really need to be assessed and have them monitored, because what helps one is not, they have to be done. That's a whole other conversation. But impulsivity, there are programs that can help that.
Good.
And so it's just a lot to answer right now.
No, I
could answer it better if, you know.
So going into that, we have another question about if someone could contact you. So what we're going to do is we're going to wrap this up today. We're going to answer the questions that are left on the comments. We'll make sure everyone gets a response. I'm going to share Linda's Facebook and website with you all in the comments as well, because I know some of you want to contact her and ask her some questions specifically. If you've got some examples of the impulsivity control, message her some of those.
Yeah, yes, I can help you.
Yeah, and then she's going to be giving away an evaluation, correct?
Yes.
So if you have commented, liked, or shared this video,
Your executive
or you
functioning.
do that, she's going to give away, go ahead and explain what
Yeah,
it is.
it's just, you know, it's not like a whole battery, a neuropsych. I just need a little snapshot. If your long-term memory, if you're 10 years old, it's on a 7-year-old level, not brain surgery, let's remediate it.
Yeah.
It's just a simple thing where I can get a snapshot. Your kid's not going to feel like, what's wrong with me again? It's on the computer. And then I interview the parent, and I get a lot of information. The website is kind of, you can go there, but it's being redone. It's a little outdated, but there's still good information on there. But that's what I'm giving away.
And it's got your contact information.
It's got my
on
contact information
Perfect.
on there.
Okay.
And it's advantages. Well, you're going to share it.
Yeah, I'll share
Yeah.
it so that you guys can just click on it really easily. You don't have to do anything. We are so happy that you guys tuned in today. We've got so many comments. A lot of people tuned in here today, and we are very thankful to Linda for coming all the way over from Jersey to chat with us, and I'm sure that we'll be back with her in the next few months to kind of have a follow-up and maybe chat about some specific questions or even topics that you guys present to us. We are going to try and do Facebook Live chats a little more often now with different professionals and adults and stuff.
Right.
So she's kicking off our new experiment with Facebook Live, and I think it went well. So
I think if you can go to the website for information, but there's some glitch in it. If you want to contact me, you can message me on Facebook.
Yeah.
Because I'll get it sooner that way.
Perfect.
Yeah.
All right. Thank you all. Thanks for coming.
Bye.
We'll see you next time.
All right.
Bye, everyone.